Good morning, folks. Today is Friday, and I think it is 27th of May. What are you cooking today? Yesterday, I saw patients in my evening clinic. One patient, it's a telephone clinic, as you know. GP asked me if I can advise on the abnormal liver function test because only young girl in early 20s with rising ALT, one of the liver enzyme, and that GP forgot to mention the young girl's BMI is 36, like 110 kilogram, 17 stone. So sometimes I feel some of my colleagues are not thinking straight. How can you not advise or mention such an important fact and at least give some BI, brief intervention, to help this young lady to find out what is causing this problem, this overeating? So I ask questions which very few consultants probably will ask when you go see. My first question was, did you have any childhood trauma? And it transpires that when this poor girl was only 9 years old, their parents had a separation, divorce, and since then she never felt secure, and she eats whenever she's stressed because we all know what eating does to our brain. It makes us happy. So this reflex that she had created, and not only her, I mean, there's many other boys and girls and men and women. We eat when you're stressed, and you don't even know that you are stressed. You're just eating because you enjoy eating, because the other bit you're not enjoying. That's why you need to find something. So any bad addiction actually serves a purpose, even smoking or drug addiction, because sometimes brain is um, so stressed that it doesn't want to think anymore. It doesn't want to do something, even if that over the years and months and weeks going the backward direction can kill you, or give you a subnormal health, because you can't tolerate the chatter in your brain and the sadness of feeling that nobody likes me and I'm not worthwhile. So I always ask few questions to my patients. What's your hobby? What do you do for a living? Who is at home? Who is your next of kin? Who is your best friend? What did you eat in the morning today? What is your last dinner and all that? Because the the food we are eating is actually killing us, and the books we are reading, I mean, not books, magazines, dirty magazines, and popular magazines, the popular movies on Netflix and YouTube, stupid videos and all the stuff, that's killing. It is not 100% rule, because I do watch funny cat videos. So but when that is your only video you watch, I do watch interesting crime thrillers and murder stories, but when that is only thing you watch, that's not very healthy, is it? We need varieties. My second patient is a very fit gym goer, young guy, and he went to see urologist, and my urology colleague kindly asked my opinion. Again, the same problem: abnormal liver function test, fatty liver. But then, as I was asking the food habit, because that's what I'm so interested in, I'm kind of pretty curious what people are eating. And it transpires that this gentleman is drinking 10, 12 cups of tea with milk. I forgot whether sugar was part of the deal or not. But anyway, and do you know why he went to see my urology colleague? Dysuria, a lot of urine, uncomfortable feeling in the bladder. And he had all sorts of investigation, including PSA, prostate exam, probably a flow cytometry and cystoscopy, but no history of food intake or drink intake. And not only that, this gentleman has got a very, what do you call, interesting habit of drinking tea with biscuit. And I ask him, when you drink tea, biscuits? And he said, yes. I said, how many? Maybe 10, maybe a whole pack. What is it? It's called custard and cream. I have to try that. It sounds very nice, isn't it? And only because he's so fit, he's so strong, and he goes to gym, probably he still kind of, he looks good. You won't think that he's got a issue. There's no significant protruded belly and stuff, but good enough, or should I say bad enough, to make your liver angry and annoyed and showing up the result on the blood test. So I'm pretty sure if this gentleman stopped drinking those extra teas and biscuits, he doesn't need to see me anymore in future. Things will revert, body will take care. The problem is our diet, our food, we're just mindlessly eating. It's not a joy anymore. It's just gulping rather than chewing. So the food should be more of a home cooked food, like our mother used to cook, not like the stuff that you buy and shove in this microwave or in this thingy, and say, oh, we are having a Sunday roast. When I came to this country, I was very surprised. What is Sunday roast? We roast every day, man. So for us, it's Saturday roast, Sunday roast, Friday roast. Every day is a roast. Although we don't roast, we cook with proper flame, not this thing. Yeah, for this is not cooking for us. This naked flame is cooking for us. I come from India, and I grew fondness about this and this, but this is a necessity. Microwave. I'm learning baking because it's an art, and I really love my cake. And there's no food that I won't eat. I will eat everything and anything as long as it is tasty. If you give me some crap telling this is very good for your health, I won't touch it if it doesn't stimulate my tongue. Okay? But the same good food can be poison if you exceed the threshold. So what is good and what is bad depends on what you do, how you move, how busy you are, what's your metabolic rate, what your body composition, what is your gut microbiome. Same food, okay? This is carbohydrate, which is probably the culprit of starting this insulin resistance and metabolic syndrome and all sorts of ill health. But we love this. I will eat it, but am I going to eat it all the time? No. I'm going to mix with other stuff so that the effect of this is blunted by other stuff. Now, onion. Indians use a lot of onion in a lot of curries, but onion is very sugary, and if you put too much onion, actually the dish, even if it's a salty dish, it'll be sugary. So you need to know your vegetables. The good food will be a lot of vegetable, lot of cooking, less of processed food, less of sugar. We will use sugar, but then you need to know when to use your bad food. This is my bad food corner. Although I'm calling it bad food, this is so yummy. This is dried fruits, all sorts of fruit, cranberry, blueberry, strawberry, nuts, seeds. And I know that when I will succumb to my sugar craving, I'm prepared. I've got the box in my bag. I'll just take it out. That's my... Anyway, today's Friday. Friday I do liver talk, and today Fairing kindly sponsoring our talk. And I'm going to talk about SPICT, a palliative tool that we are planning to use on our liver patients to give them better care, better support, so that either they heal or they are more comfortable. And this is something I'm really passionate about. I'm a liver expert, I'm a gastroenterologist, I'm a foodie, I'm a chef, but my passion is patient education. And I think a little bit of investment, money-wise, time-wise, knowledge-wise, into patient education will save you a lot of money, a lot of effort in the long run. You change your brain. You change somebody's brain, the body will change. Because if I influence you to do this, your body will change. So monkey needs to be tamed. Monkey should not be the decision maker, and that is sadly the case for majority of our patient and staff and colleague. Monkey is making all the decisions. Monkey is getting annoyed with criticism, with antagonism, with stress and everything. We need to wake up. We need to wake up and enjoy the life and help others. Everybody is looking for happiness and peace and love and all the money. Also, money is very, very, we are asking for money. But are we giving any money to anybody? Other than close family members, just out of the sheer goodwill, like a good cause. No, I've seen even rich people when I approached them for the charity liver ball that we did, hesitant. Some are so generous, even with a salary which is way low than a rich consultant. They immediately gave me 2 tickets, sponsored 2 tickets, and some of the richest consultant, they're thinking, okay, I'll think, but they may be contributing somewhere else. So don't judge without knowing the whole situation, that why that person doesn't want to invest in your cause. Maybe that person is investing in some other cause. So if you want to work happily, decrease your judging level, okay? Even if that is involving you and your mission that people are not supporting, don't criticize them for not supporting your mission, because you may be a bad salesman. You're not selling your mission well to the other people, because if you do, at some stage they will come. Okay, by the way, you need a very good pot, and not only pot, lots of pots, you know when you do lots of cooking. But trick is to learn to use vegetable, and vegetables are bad, they don't have any taste. If I give this, would you eat? No, no, no. But the moment I do pur bhara kakrol, pur means stuffing, and kakrol is this crazy looking vegetable. I probably, most of you guys probably never seen this in your life. It's so yummy. You can just slice it and fry it, or hot roast it. It's crispy. Or my plan is to make a small nick, take everything out from its tummy and mash it and put it with potatoes and tomatoes and raisins and spices and put it back again and then cook. Same with this, but this again I will use poppy and cashew and coconut. It's called potole dolma. Okay, dolma. That's another delicacy. You don't do this every day. It's for weekend. It's for guests. And this is jhingue posto. Okay, another very good food. For all of these are actually good for your gut microbiome, because if you don't give them food, this is not for you. You like the taste, but you cannot digest most of this. The bacteria can, and if you don't give bacteria the food, they will eat the mucus lining, and then they will go upwards to your small intestine and populate and colonize, called SIBO, small intestinal bacterial overgrowth. You will be utterly unhappy with your gut and life in general, because these bacteria produce the happy hormone serotonin in your gut, and if they are not happy, you are not happy. Okay, so if you want to be happy, eat vegetables, sing song, okay, go run, help other people, love your spouse, love your wife, love your neighbor, love your enemy. Buddha said, Gandhi said, when you say love your enemy, I'm not telling pardon your enemy. You have to be vocal about injustice, but not to the person. You need to find the flaw in the system which has caused that person. Like, you need to find out why Hitler become Hitler. Okay, because otherwise, if you just kill Hitler, another Hitler will come. So you need to know how a child born innocent becomes a demon. Okay, what trauma that happened to that child that changes fundamentally the brain, and that child is now gone seeking revenge and thinking all my suffering is because of this community. Yeah, religious community, non-religious community, and I have taken my life mission to punish them. And that's happening to most of us. There is suffering, then there will be suffering. But how do you find the meaning of that suffering and find a target for your suffering? That is going to change everything. That is going to start a World War III, or that might bring heaven to the earth. How you approach. The problem is not the problem. Problem is how you look at it. Okay, so a lot of wisdom on a Friday morning. Have a lovely day. I have to go head to the hospital quickly, and a lot of thing I need to do today. I keep thinking of signing off my trainees and their ARCP coming. So 2 days the deadline. Their portfolio will be on virtual lockdown. So I have to finish it today. Plus the liver club, the sponsored pizza. Every Friday, most Fridays, almost every Friday, we do pizza and talk about gut, mostly liver. Yeah, so have a lovely day, but think about it. My channel is not a cooking channel, it's an inspirational channel. Okay, so have a great day.